Okay.
time and if they are interested.
Yes, yes.
They may just pitch in, and we can have some inputs from them also. I don't know who all will turn up, but just I requested few of them.
Yes, good, Priya.
So that becomes. Actually, Aryan is helping me, so I'm using this laptop. So that's why initially you got that Aryan. Acha, come. How do I unmute in case I have?
You are unmuted. You are unmuted.
Oh, sorry. Mute.
Yes, scroll up to here.
उमेश सर एक बार चेक कर लीजिए, वीसी सर ने ज्वाइन कर लिया है, आप सर को को होस्ट बना।
हाँ जी, कर लिया मैम।
हाँ जी। Good morning, sir.
Good morning. Good morning, Dr. Neetu. How are you?
I am fine, sir.
Good morning, Dr. Vivek. Welcome.
Good morning, sir.
Yeah, thank you very much that you have agreed and you have come here with us today.
It's always a pleasure to join Neetu for such activities.
So nice.
And I think it's a regular affair now we are doing.
So nice of you. I know it is all personal. It doesn't normally happen, on an official basis. But I'm really happy that you are here with us today, and I'm sure your expertise will motivate all of us, and will definitely, help in maintaining our health better.
Definitely, the whole idea is to touch upon some relevant topics which are relevant in today's world because of the volume of disease and the morbidity of disease, and creating awareness should be the motto of every doctor, I suppose, and that is the best way forward. Preventive treatment is the key.
Yeah, and basically, Dr. Nowadays we are living in an environment where lots of problems because of environments are also coming. So especially in Faridabad, a lot of problem with the drinking water and other things, and a lot of food which we get is not pure. So many things are happening. So I think this kind of awareness, if you whatever you will tell us today, is going to help all of us, and especially we have large number of female staff in our university. Along with female staff, we have got large number of female students also. So it will definitely help all of us. And even for the male, for example, we have our family, and we can also take care of family properly in case we know these things. So I welcome you to this platform, and I request the organizers, especially to Dr. Neetu Gupta, to invite Dr. Vivek Aggarwal And then let us start his
Yes.
talk so that we don't waste time in many other things. Yes.
Yes. Dr. Mahima, please proceed. Mahima?
Yes, ma'am. Good morning to all present here. I am Mahima Malik from Department of Mathematics. Extend a very warm welcome to Dr. Vipin sir, Vice Chancellor Dinesh sir, all the dignitaries and participants. Today we have gathered here for this webinar on breast cancer and thyroid, being organized by the Women's Cell of JC Bose University of Science and Technology, YMCA, Faridabad. JC Bose University was established in 1969 as an Indo-German project, a joint venture of the National Council of YMCAs of India, the Government of Haryana, and the German Central Agencies for Development Aid Bonn, Germany. Prior to 1996, this university was affiliated to MD University, but after that, the state government took full control over the college, and in 2009, it became a university through the YMCA University of Science and Technology Faridabad Act 2008, and finally, in 2018, it was renamed as JC Bose to commemorate the name of an Indian polymath, physicist, biophysicist, botanist, and an early writer of science fiction, Sir Jagdish Chandra Bose, through YMCA University of Science and Technology Faridabad Amendment Act 2018. 2020 has been a powerful reminder that we are all in this together. From the moment the current pandemic changed the course of history and the direction of our lives, our choices and actions, now more than ever have the power to protect the most vulnerable among us in a big way. The same holds true when it comes to breast cancer and thyroid. Breast cancer and thyroid changes you and can change, be beautiful. Well said by Jane Cook, who was a breast cancer survivor. A 2018 report of breast cancer statistics recorded more than 1.5 lakhs new registered cases and 87,000 deaths due to breast cancer. Breast cancer and thyroid are by far the most common issues in women worldwide, both in the developed and developing countries. With an aim to aware the young about the shocking rate at which the breast cancer and thyroid are rising, the Women's Cell of JC Bose University of Science and Technology is conducting this beautiful session on breast cancer awareness. Dr. Neetu Gupta ma'am is currently the chairperson of the Women's Cell and is also the chairperson of Department of Mathematics since 2018. She has more than 15 years of teaching experience in the university. She has published more than 30 research papers in renowned international and national journals. She has organized national conferences, SCPM workshop recently, and many expert lectures. I request Dr. Neetu ma'am to kindly give us a brief introduction about the Women's Cell of the university.
Thank you, Mahima. Honorable Vice Chancellor, sir, our keynote speaker, Dr. Vivek Aggarwal, one of the best endocrine and breast surgeon from Maharaja Agrawal Hospital, Delhi, respected deans, chairpersons of various departments, all my colleagues and dear participants. On behalf of Women's Cell, I extend a warm welcome to all of you. I also welcome other distinguished doctors among us. I would like to express my gratitude to our Vice Chancellor, sir, who gave permission and support to organize this webinar. Women's Cell plays an important role in voicing opinions on important matters that affect the daily life of female students and faculty members. It provides a platform where students can comfortably participate and share their views. It actively promotes gender equality. It also seeks to empower young women to attain emotional, physical, and mental freedom to withstand the changing phases throughout their life. Other important objectives include giving career guidance, functioning of a counseling center, and conducting health awareness program, etc. Today's our webinar is on the topic breast cancer and thyroid. Nowadays, both the diseases are very common. Breast cancer and thyroid are on the rise both in rural and urban India. Breast cancer is one of the most common type of cancer which affect women majorly. Yesterday, I studied that 22% females died due to breast cancer in India. It's really very sad that for women under 40, breast cancer is often diagnosed in its later stage, when it tends to be more aggressive. This means the survival rate is low because the detection takes place late. Also, according to the statistics, thyroid disorder are on the rise in India. Approximately 1 in 10 Indian adults suffer from hypothyroidism. So it is very essential to know more about these diseases. Today, our keynote speaker, Dr. Vivek Aggarwal, will talk in detail about breast cancer and thyroid causes, symptoms, and prevention. I am sure that this session is going to be very useful to everyone present here. Thank you. Now I ask Dr. Ms. Mahima to proceed further.
Thank you, ma'am. Our Honorable Vice Chancellor, Professor Dinesh Kumar, who is a recipient of prestigious Homi J. Bhabha Memorial Award.
Mahima.
Yes,
yeah,
sir.
let's invite Vivek Agrawal.
Okay,
Because I'll not be able to do any justice and I'll not do any, addition to the knowledge. So let us invite Dr. Vivek Agrawal. Let me invite. I request Dr. Vivek Agrawal to please come and speak to our faculty members and our students. Unless you have something to say about Dr. Vivek Agrawal, because I have not seen his CV. So if you can speak some good words for him, that would be really good.
yes, sir. Okay, so Dr. Vivek Agrawal has specialized in endocrine and breast oncosurgery. He did his MS in general surgery and MCH from SGPGI Lucknow and treated various surgical problems related to thyroid, parathyroid, pancreas, and breast oncosurgery. He is currently working at Maharajan Agrasen Hospital and is a visiting doctor at Fortis Hospital and in Balaji Action Medical Institute. He is one of the best endocrine surgeons in Delhi with over 16 years of experience and has worked at BLK Super Speciality Hospital in New Delhi as a consultant endocrinologist and has won ISS travel grant for International Surgical Week, Montreal, Canada in 2009. He is a member in International Association of Endocrine Surgery and a member in Indian Association of Endocrine Surgery too. His research area include thyroid disorder treatment, minimally invasive surgery, and congenital disorders evaluation. Now, without wasting any time, I would like to invite Dr. Vivek Agrawal to address everyone gathered here.
Thank you, Mahima, for such a kind words. I think you have overstated my CV. I'm just an ordinary endocrine surgeon, and I'm just trying to do justice with my job as far as possible. And as you have laid the pitch well and you have provided so much of statistics, which probably even I'm not aware. So, this updated statistics has really laid the ground for my talk nicely. And my job was today to talk about breast cancer and thyroid disorders, but I took this liberty to focus more on breast cancer. Reason being, this is probably more relevant problem in today's world, today's time, and especially among females, and the awareness about this disease is more relevant, more prudent, more fruitful. So I'll be primarily talking about breast cancer, and then maybe at a later half we can touch upon thyroid disorders as queries from our viewers. So if I think, yeah, everybody can see my screen and the PPT, is it visible?
Yes, yes.
It's not moving forward. So October, as you know, is acknowledged or celebrated or commemorated as Breast Cancer Month, and the reason is again same, to create awareness. And this pink ribbon, which you can see on your screen, is a symbol of breast cancer awareness. Of course, now it is November, but nevertheless, uh, it is, it is important to talk about this disease at any point of time, any month of the year. So October is just symbolic, but I think we need to repeatedly keep talking about this disorder to create more and more awareness. And as you have already given beautiful statistics about this cancer, which as a specialist, even I was not aware of so many points, but just to, add on to the gravity of this disease, I would put on few points. This is, of course, commonest cancer in females in India. It is the fastest rising cancer among all cancers. And every 5 minutes, one female is diagnosed with breast cancer, and every 15 minutes, one female dies of breast cancer. And as you already pointed out, younger females in India are being diagnosed with cancer compared to West, where elderlies are diagnosed with breast cancer. The reason may be, as Dr. Bansal pointed out, more pollutants, more carcinogenic elements circulating in the environment. And because of lack of awareness, more females present at a late stage. So the reason of this young females presenting at a late stage is probably poor access to healthcare and dedicated breast specialists units limited to only small part of urban India. And we have published this data already in World Journal of Surgery, and this is the probably reason why we are here today to improve upon these statistics, improve in not in terms of maybe early diagnosis, early catching up the disease at early stage, and giving better outcome. So with such a statistics put forward, everybody will be wondering, what is this breast cancer after all? Of course, the word speaks about itself. It's a cancer in the breast. And but what is cancer? We have to understand this. What is cancer? Like every thing in the world is made up of a basic unit. If some of you are from science background, you'll understand the word atom. So every structure in the world is made up of a basic unit called atom. Similarly, our body is made up of a basic unit called cell. And these cells, when they multiply, they grow into different tissues. Like some of these cells will form muscle, some will form bone, some will form brain, some will form kidney, liver, and similarly, some cells will form breast. And all these cellular structures, they have they are very well genetically controlled by in terms of numbers, in terms of their uh, changes, in terms of their morphology, their looks. And this tight control, whenever it is lost, these cells start growing unchecked, uncontrolled. It is like if you've heard of kharpatwar in a in a farmland. So that eats away. They start growing like anything, and they eat away all the normal crops. So similarly, these cells, when they start growing unchecked, they will uh, start eating from the normal cellular structures, normal part of the body. They will eat away these cells, they will eat away the nutrition, and that in this process, the body becomes weak. They start damaging vital organs, and this is what actually cancer is. And whenever these cells are confined to a limited space, we call it just a tumor, and when it spreads beyond its confine, it becomes cancer. So next question would be, is breast cancer present only in females? Perhaps not. It is also seen in males, although the percentage is less, 1 in 100. You can say one male. If we have one male to see with breast cancer, there will be 99 females suffering from this disease. Now, the most important question is, if this is such a dangerous disease, how do we know that we are suffering from this disease? What are the symptoms of this disease we have to look for? And this is probably the most important slide of my talk, which every female or every all of our viewers should try and register this. So the commonest presentation of breast cancer would be in form of a lump, or what we call as gant, or tumor, rasoli. These are various words we use for these lumps. And this is like a hard tissue present in uh, one of the quarters of breast. And other than this, there can be other symptoms like architectural change in the breast shape, nipple discharge, pulling in of nipple, dimpling of the skin, purdy orange, we call it purdy orange, which means orange peel like appearance. There will be small, dot on the skin will be thickened. So संतरे के छिलके की तरह जो चमड़ी हो जाती है, वो एक अंडरलाइंग ब्रेस्ट कैंसर का साइन है. जो उसमें अंदर निप्पल का धंसना, निप्पल में गड्ढा पड़ना, ऊपर से चमड़ी में लाल लाल हो जाना, रैशेस, nipple में ulceration, all these can be sign and symptom of breast cancer. So I'll just keep this slide for hold for a moment, and so that all of you know what we are looking for when we are trying to diagnose breast cancer. But this does not always mean that any lady having all these symptoms will have breast cancer for sure, because most of the lumps in breast are benign. That is the good part. And lumps associated with pain generally are less dangerous, and lumps which are painless are probably more dangerous. ज़्यादातर जो हमारे पास महिलाएं आती हैं वो ये कहती हैं कि भाई ये गांठ है और साल भर से है. तो हमने कहा भाई आपने पहले क्यों नहीं दिखाया? तो कहती है ये कुछ तकलीफ ही नहीं देती है, ये तो अब थोड़ी ज़्यादा बड़ी हो गई है, तो मैंने सोचा कि चलो ओपिनियन ले लेते हैं. And because of our social structure also, probably they're not so open, and they will not be discussing these problems unless you have this disease flared up to a great extent. So if we diagnose this at an early stage, probably this is not a bad disease at all. It still remains a good cancer. But what happens if we don't, if we ignore these symptoms? So when we ignore these symptoms, this disease can become from good to bad and to ugly. And you can see these pictures. The first picture shows a lump which is not visible, just a lady could palpate it during, one of her self-examination. The other is when it becomes visible, and third is when anybody can tell from a distance that, okay, you are suffering, something is wrong in your breast. And this kind of picture is not acceptable in today's era. So, the whole idea of this talk is to bring this stage back to stage 1, or a good tumor which is diagnosed before it shows off. And what can be done to avoid this situation? Well, we call this as screening for breast cancer. Screening basically means to detect a disease before it speaks about itself. So before the disease tells you that I'm here, you have to diagnose it, you have to find out. And that is what is the purpose of screening, to catch the disease when it is at a very early stage. And the two methods which are important in case of breast cancer is, one is breast self-examination, which is a very simple tool of self-examination, doesn't require any hospital, any doctor, any specialist unit, any infrastructure. So it is, you have to train yourself to examine your breast and to detect this disease as early as possible. And another is mammography, which is a radiological technique. I'll dwell upon it in a moment. Most important focus would be, today would be on breast self-examination. So breast self-examination, how do we do it? It is, first of all, it has to be done at a time when your breast is in a position when it is not tense and you can easily detect any changes. It has to be done at a monthly interval, let us say the best time would be somewhere on 10th day of your menses, when the breast is not that much toned, it is little soft, less of edema, less of water retention at that time, and you can appreciate the changes easily. You need not do this examination every day, because then the changes become unnoticeable. You know, when you see your children at a interval, you can appreciate, oh, they are growing. But if you see your own son daily, probably, you feel that, oh, he is the same for years together. So same as for, any change. When you have to notice, it has to be at a certain interval. Looking at this, every day would really not help. And what is the best way? I'm just keeping this slide for long. I could have cut short this, but these are important things. These are the things which we want to convey. How do we do it? The best way is to do it when you are taking a bath. The female has to stand in front of a mirror and with the arms by her side, straight, and maybe behind her head. These are the three positions in which she has to look in front of a mirror and notice if there is any change in the nipple, any inversion, any dimpling of the skin, any lumpiness, any projections, any redness of the skin. All these you have to try and notice. So any difference from what it was a month back, any physical change in the breast, what it was a month back, has to be brought in your own notice and then to the notice of your doctor. And then next step would be, while you are taking bath, with the little bit of soap in your hand, so that it becomes, there's less of friction in your hands. You try and slide your hand over your breast in different directions, as has been shown in this picture. So idea is to check every part of your breast, every quadrant of your breast, and it has to be done with flat of your hand. If you examine like this, every part will be, felt as a lump. So the best way is to examine with flat of your hand. So when you press with the flat of your hand, when you slide flat of your hand, then if you notice any lump, that is of relevance, and not a lump which you are trying to hold between your thumb and fingers. Also, you have to check any lump in your armpit. That is also important, because these malignancies, they travel from breast to armpit. So that again becomes a very, alarming sign if you have a lump in the breast as well as in the axilla or the armpit. So uh, then next, coming to the next technical slide, I would just give a pause and see if any of my viewers want to have any query, because many a times what happens, by the end of the talk, you forget what you want to ask. So if anybody wants to ask, let's make it more interactive, so that, somebody benefits out of it rather than becoming a mono dialogue. So any of the viewers who want to ask anything till now?
Good afternoon, doctor. Uh,
Good
we have
afternoon.
received one question, sir.
Okay.
The question is, sir, how to increase the awareness on this issue in village? Can there be a link with the village panchayat of doctors so that workshops and seminars could be conducted? This is a question that we have received, sir.
I think that's very relevant question, and the spreading of information should start from villages. In cities, we already have access to doctors, healthcare facilities, awareness, Google, so many, social media which help us to know about this disease. But villages are one which are, uh, which don't have access to all these things, even in today's era. And also because of social stigma attached and our social structure, they don't come, the females don't come out so openly. So definitely, village panchayat and other relevant people can play an important role. And creating awareness can be by so many ways. like one of the things which we are doing now is creating awareness. We can have similar talks. Number one, to create information about what is breast cancer. Then we can involve the Anganwadi workers and other healthcare workers at village level, teach them how to do this breast self-examination. And this is most important, key factor or the most important way how we can catch up disease early. So these workers, healthcare workers in at village level has to be taught this, and then they can help the females examine, and maybe they themselves can do these examinations at regular intervals for all the females in the villages. And of course these things have to be worked out sitting with administrators, how else we can you know add to this. Anything else? So okay, we'll continue with this. So next best screening tool is mammography, and a lot of you must have heard about this. It is a special X-ray of the breast, wherein two X-ray plates are put across along above and below the breast, and films are taken in different directions, and then you try and pick up any change in the at the cellular level or maybe at the architectural level at earliest possible size or stage. And this is a simple X-ray technique, doesn't really cost much. The radiation exposure is minimal, so no side effects. And it has been advised to be done every 2 yearly as a screening program in many countries. Of course, has to be used judicially because sometimes they pick up normal architectural changes also, and which can bring false alarm also and unnecessary create stress to the female. So it has to be used judicially, but is an important tool to early diagnosis. So whenever you have these symptoms or on screening, you have some suspicion of this kind of disease, the next best thing is to meet a breast specialist. He will conduct certain basic investigations, mammography, as we have already discussed, and then there is a test to prove the disease, which is basically we call it as biopsy, which can be done by different methods, either using a fine needle wherein a needle is put inside the lump, few cells are withdrawn, and then they are tested for whether they are carrying some bad cells or not. If they're carrying bad cells, that means they're malignant. Then further investigation is done to stage the disease and plan the treatment. And broadly, the treatment of breast cancer can be divided into five modalities: surgery and chemotherapy being very important one, followed by radiation, hormone therapy, immunotherapy, wherever relevant. So all these modalities are not being utilized in every case. The treatment has to be individualized. And now, whenever you are diagnosed or whenever any female is diagnosed with breast cancer, the first thought which comes in her mind, or most of the times the female when they come to us, even when they're not diagnosed or they're on the, in the process of diagnosis, the first question or the first fear that comes in their mind is that, am I going to lose my breast? Well, the answer is yes and no. It all depends on at what stage you are presented to us. Early breast can be preserved very well, and at late stage, of course, we don't have a choice. So again, the whole idea of this exercise is to preserve the mental state of the female, the womanhood, the psychological impact which comes with breast removal, how we can reduce this. So early diagnosis. Again, I'm trying and uh, again and again trying to impress on this point that early diagnosis is the key to treatment of breast cancer. And nowadays, we do breast conserving surgery for early stage breast disease. You can see in this picture there is a small cut through which the breast lump has been small lump has been removed, and there's no change in the architecture of the breast. And even if the lump is little bigger, there are oncoplastic techniques wherein we remove the lump with a good margin and still try and retain the shape. And you can see the outcome is as good as a normal breast. So nothing to panic, but then again, this cosmesis comes with a cost. Cost in the sense that radiation becomes a must. The chances of local recurrences are high, so you don't have to always choose this technique. It all depends on your state of mind and the aggressiveness of the tumor, the stage of the tumor. So let it let this decision be in discussion with your doctor, how comfortable he is doing this procedure, how much assurance he can give you in terms of overall oncological outcome. So just don't uh, give him give him choice from your side. Let it be a discussion among the two, and then decide upon the treatment. Now, once a woman has been diagnosed with breast cancer, obviously, other than surgery, everybody knows, okay, now I'm going to get chemotherapy. It is very dangerous. Perhaps I'm going to die. I'll not be able to tolerate chemotherapy. So many, negative thoughts start coming to you. So here I would just like to tell you that nowadays chemotherapy for at least breast cancer is not that risky. It is easily manageable. Of course, there are complications associated, but then there are medications to counteract those complications. And you do have some issues like hair loss, temporary, loss of taste and all. But believe me, as soon as the chemo is over, you are as good as what you were before treatment, and you will have probably much better hairs. And uh, uh, most of the chemotherapies, most of the patients can sail through this chemotherapy very easily. So you don't have to deny this treatment because this is very important for the outcome. Now, of course, once the female has discussed her treatment modality, she has undergone some treatment, this fear will always be there in mind that am I cured of the disease? Is this a curable disease? Uh, am I going to die of this disease? So again, the answer is that if you present at an early stage, the survival is good. It is good to a tune of 90% in stage 1, 70 to 80% in stage 2, and as things become, as you get delayed, as much as you delay your treatment, of course, the survival becomes more and more poor. So again, the key is to come to your doctor as early as you have any suspicion of such disease, whether you have or not, let your doctor decide. But whatever we discussed just now, the symptoms, as and when you happen to diagnose this symptom, please do go to your local breast specialist. And once she is undergoing treatment, this is what I'm trying to, these questions are the one which are asked by my patients most of the times during the course of treatment. So I've just tried to put them and compile that as a talk. So, the next question is, oh, I have two daughters, doctor, will they also be having this disease? And then, of course, this fear is prudent, but let me tell you that not every female who's diagnosed with breast cancer, their daughters are at risk of breast cancer. There are certain add on factors which make them more risky. And this point is again important in our society because, this this poses some resistance during the marriage of their daughter and social structure. So one has to understand that if a mother is having breast cancer, not necessarily that the daughter will have it, except maybe when there is a strong family history, when multiple members, like multiple sisters, are having this cancer at a very young age, or maybe there is some genetic mutation test which are positive in them. So that's a small percentage. So again, you have to understand that you don't have to deny, marriages and other social relations based on mother's history altogether, which is very common in our society because I've been facing these questions. I really have a tough time answering them and convincing them that please don't make this, uh, this issue come in between uh, such relations, building up of such relations. Then if I convince them that, okay, your daughter will not have this disease, then they say, okay, doctor, but my sister didn't have this disease, then why I am having this? My mother didn't have this disease, then why I am having this? Oh, now again, it is really difficult why a female has this disease because there are only few conditions where we know it is genetically determined, but most of these are sporadic. I mean, it is just matter of chance. Of course, there are reasons why a particular female will have more of this disease compared to another female, and these are like a female who got married late, who's got less children, who couldn't feed her children properly, or who has taken some prolonged hormonal therapy for some hormonal disorders or early hormone failures, or who had early menarche, late menopause, obese, sedentary lifestyle, smoker, alcoholic. These are add-on environmental factors which will increase this risk of breast cancer in some females. But sometimes, even if you don't have these factors, you can still have this disease, and only God knows why He is given this disease to one and not another. But of course, whatever is in our hand is improving our lifestyle and not getting addicted to this alcohol, breast, having more healthy lifestyle, good food, uh, do regular exercises, try and reduce weight. So all these are factors which may become relevant in a large section and which is under our control. The rest, of course, is a matter of luck. And then, can we prevent this by any vaccination? Of course, till date not. But as I discussed, whatever is in our hand is, try to improve our lifestyle and again early detection. I'll keep stressing on this point because as long as we don't have vaccine like corona, we have preventive measures. So is for breast cancer, either we try and prevent or try and diagnose it early so that we get appropriate treatment and good outcome. So with this, what is the take-home message? Uh, it is again, which I've been impressing again and again, learn to do breast self-examination, try to notice these symptoms as early as possible. Meet a breast specialist if you happen to encounter any of these symptoms. And don't be afraid. This is very much curable disease if you come in time. And most important take home message is that let's spread this information which we have learned today among all other colleagues and our society and wherever possible. Let's discuss this out more with our colleagues or other female uh, staff or wherever you go in the society. Let us make this also a topic of discussion so that you can pass on this information and right information, I would say, without creating panic. It should be more like awareness. So this is probably the most important take home message, creating further awareness about what we have learned today. And I think with this, I would thank you all about breast cancer. I don't know if we have time. We can take up questions or we can just touch upon thyroid if you want. But I would like to restrict to breast cancer today because of its relevance and the magnitude of disease and the statistics which you have put, which Dr. Mahima has put initially, Dr. Neetu has put. So let's focus on this so that we at least register something rather than mixing up everything. But still, if you have any queries about thyroid, we can just take it up spontaneous. I mean, that's important. No need to.
Okay, thank you so very much, sir. So, basically, breast cancer affects many women belonging to several age groups. There is a simple proposition to dealing with it, and thank you for making us aware of the issue and eradicate. And we'll try to eradicate it as early as possible. So, I would like.
I hope this talk was of some use to all of us.
Yes, sir.
Okay, I request Ray to take all the queries.
Thank you, Mahima. I would request the audience to please mute themselves so that I can ask the queries. I have received a query from Kajal. Her question is, what is that mean if there is a small spot dot-like seen in the right breast after X?
Just come out again. I couldn't hear you. I was lost. So, Kajal, what did you ask? You have some? Hello?
Shrey, can you repeat the question again?
Yes, sure. What does that mean if there is a small spot dot-like seen in the right breast after X-ray?
This dot you are talking about is, if seen in an X-ray mammography, has to be, read by the radiologist to derive to some significance. And this reporting we call as BIRADS, and the numbers are given to these spots which are seen on these mammograms. And depending on the severity or the risk of the cancer, they are scored from like 1, 2, 3, 4, 5. So more higher the number, the possibility of malignancy is high. uh, Before I take up another question, do we have any of uh, my patient which who have joined? I sent this link to few of them. How can I trace them if they are here, so that they can also share their experience?
Sir, can you tell me their name? I'll search in the participant
Okay,
list.
it was, I think, Mrs. Malhotra, Mrs. Sodi, Jyoti. Uh, I mean, can they raise hands, or is there a way they can just unmute themselves and come out?
Mahima, search them by name.
I don't know actually. They didn't
Yes,
said they
ma'am.
might join.
Okay, so we are having Jyoti
Can,
over here, but I'm not sure she is the patient or not.
same.
So I'll unmute her. Okay.
So if they're listening to me and they can just, uh, is there an option to unmute themselves? No.
Sir, there's an option that they can raise their hands and
Hands.
I can then unmute them. But
Okay. So nobody's raising hands. Oh.
no, yeah, Vipul
Vipul,
girl.
Vipul.
People.
Okay, so Vipul,
Vipul,
you
no, I'm talking. Oh, Vipul, yeah. Vipul, you can join because I know I operated on your mother. Vipul is my cousin, so is a doctor, is a very renowned orthopedic surgeon in London, and I think we had a talk by him couple of weeks back. Beautiful talk, and I in fact gained maximum from his talk. Vipul, if you can share something, your
Yeah,
experience, the agonies which a patient or the as a relative you feel, you face, and then uh, how you start searching about treatment, the problems you face, the thought process which goes on in the mind of patient, all those things.
yeah. Thanks, Dr. Vivek, for this talk. It was very nice talk, very informative, right from the basics, and very understandable to all of us. Yeah, as you rightly mentioned, last year I have come across this with my mom, and you were really, really very supportive and very helpful. And the kind of support you have shown that point of time, it was really helpful. But honestly, if I speaking, it was a quite, I will say, traumatic experience for patient as well as from the relative. The thing is that with most of the tumors, you have some symptoms and you are struggling with them. So if you come to know about diagnosis, you probably will be somehow somewhere prepared that you are having something wrong in your body. With the breast CA, you don't have any symptoms. It's just a lump, and most of the people are asymptomatic. They say maybe it's just something which probably don't need that attention. And when they come to know that this is a cancer which need uh, a prolonged treatment, then this definitely changes their life. So I realized that in India we have very good treatment, we have very good doctors, but in terms of mental support or counseling or communication, that is a bit which I probably find is still lacking. It would be nice, like if we have a counselor or somebody along with the oncology team who will speak to the patient, who will understand what's their concern, what they are worried about, and answer those questions. Although as a doctor, you were very helpful and you have answered all the questions for us, but it's not the case with everybody. And they keep on hanging around with all those questions going in their mind, like how's their life gonna be, what's happening to their family, what are the cancer, and there is a bit of anxiety and depression going on in their mind with this treatment going on, as it's a prolonged treatment. So I would I would like to have some point of time in India where we have this mental health support team or counselor along with oncologist supporting this patient, and speaking to the patient about their concern. Otherwise, treatment wise, I have no doubt Dr. Vivek is one of the best surgeon, and he is not even a surgeon. It's like he's a very good counselor, and he is all up to date with the facts, and he support his information with latest evidences. So at any point of time, I would say that uh, he has supported us very well, and I would always recommend if anybody asks me for this condition to Dr. Vivek. Thanks.
Thank you, Vipul, for your kind words and your suggestions. Definitely, we are lacking in on the issues you described, and we are always in the process to build that up. And in India, these things are not given so much of importance by the administrators. The hospital, unless the hospital administrator they become close to the agony of the patient, they will never understand the need of these kind of add-ons. So, but we keep we keep trying to press on them. We keep trying to make efforts to improve on these systems, and definitely one fine day we'll be at par with what our patients want, at par with best centers in the world. In this hope, we'll keep doing our bit.
Yes,
Any
doctor.
questions? Yeah.
Yes, doctor. We have one more question from Priyanka. She's saying that I always have upper back pain. I always think this is due to my heavy breast and tight bra keeping digging my shoulder. Although I never have pain in any part of my body except upper back. Is there any problem in my chest? I am confused, doctor. Please take my query.
Oh, again, it's another important question. Maybe perhaps not because of cancer, but enlarged breasts, heavy breasts. It's a common problem seen in females. They have back pain. It is very well known, and the answer to this would be wearing appropriate brasseries, sports brasseries, or surgical intervention in terms of reduction, mammoplasty. If you if you're really bothered your day-to-day lifestyle, your work is hampered, then maybe you have to resort to aggressive treatment like reduction mammoplasty, wherein the breast size is reduced to, make you more comfortable. But of course, that comes with its own problems, so that has to be discussed out at what stage you should do that, till that you continue to use better quality braceries, sports bra, and all those things.
Okay,
Doctor,
doctor.
I have one question. Hello, am I audible?
Yeah, I can hear you. Please.
Yeah. Actually, I'm from computer engineering background, right? Our MTech research scholars, they are very keen to do research in this area for the early detection of breast cancers and something like that after applying the ML, machine learning, or the artificial intelligence concepts. But the major thing which we face, major problem which we face during the research is data set. Can you suggest us or can you guide us from or by what way we can get these type of data sets for our algorithms, for our advanced stage algorithms or the research?
I think that's a very complex, issue. Bringing machines up to human levels, it's really a challenge, and diagnosis not only involves basic investigations; it involves the touch sensation, the history, the information which patient provides, and investigations, the family history. So many things are put together to diagnose a thing. So integrating that with artificial intelligence is a challenge, and this it has to be a long-term process, ongoing process. You have to tie up with centers who are dealing with high volume disease. Then your patient also has to be intelligent enough to cooperate and provide you data. Then the centers have to keep all the information in a well formatted way, and unless the intelligence of the society rises, the treating department, treating physicians, and all involved relevant people rises, it is a challenge, I think. But of course, you can build it up gradually. You can just keep adding to information. It's going to be a long-term process. So you have to tie up officially with some research institutes who can give you more data at one point of time. Uh, Besides this, I'm not much aware of how do you build up artificial intelligence, and I always keep wondering how you have really put this much of information in a machine to what took us so many years to understand, and the machine is doing it wonderfully, within minutes. So I think that for that we need to, people need to sit together and discuss out. It cannot be discussed in such forums where we are more aiming at awareness rather than building up new projects. So it has to be with more, more people put together from different fields. Maybe that can solve your problem.
Okay, thank you. Thank you so much.
Thank you, doctor. We have next question from Bharti. If someone having lump in armpit, we can say it's early stage of cancer, or lump can be seen due to another reason. If yes, then it can be dissolved by medicines as well or not. Please clarify, doctor.
Okay, again, it's a big topic. Breast lump in armpit can be because of n number of reasons. The whole idea to talk about this in my talk was that breast cancer is one of the reasons, and if this armpit lump has can be because of two reasons. There is some breast tissue in the armpit. If it is coming from that, it may be early stage, but if it is a cell which has moved from the breast to the lymph nodes in the axilla or the armpit, it becomes a little higher stage. Precise staging we cannot tell based on this much information, but definitely it is little advanced, and not necessary that all lumps in the armpit are malignancy. There can be infection, there can be tuberculosis, there can be simple secondary reactive lymph nodes. Most of them will settle with medication, If it is malignancy, then of course we have to resort to all modalities of treatment we discussed, and best is to then discuss with the specialist, let him first diagnose what it is, and then appropriate treatment can be given, both in by medication if it is not malignant, and multimodality if it is malignant.
Okay, doctor. The last question is an anonymous question, and it is like cancer is very difficult to diagnose as very initial stage. So, what will be your advice? When should a person visit the doctor, or every woman after the age of 40 should do a yearly checkup? What will be your advice, doctor, onto this?
Okay, very important question. I think most important for today's talk. After 30 years, every woman should do breast self-examination every month, and every 4 monthly she can visit a trained nurse or a female breast specialist for clinical breast examination, especially if there is a strong family history, and a screening mammography after 45 or 50 years, at least if you have a strong family history. So that should be the minimum one should do. Uh, Mammography, the answer would be a little controversial because that involves resources, and it has to be a national program. Individually, yes, you can do it every 2 yearly, but has to be brought in as a national program. Only then probably this can be offered to female, large section of female. But breast self-examination is simple. We discussed this today. Every female can do it once a month, and that's it. And most of you will be able to detect uh, the disease in time. It's a superficial disease, so anybody can pick it up.
Thank you so much, doctor. Now I would pass on to Mahima for further proceedings.
Okay, sir. So I got a query too. So we came to know that only 5 to 10% of the cancers are thought to be hereditary. So, and the rest 90% are largely due to the lifestyle and environmental factors. So, what are these environmental factors?
I think we have already discussed. It is how much time a female is exposed to the reproductive the hormones, how much time she has been into the reproductive age. Number one, this can be derived by when did she start her menarche, when did she had her menopause, did she breastfeed, how many children she had, because those are the periods when you have a child, you are not exposed to those hormones. When you're feeding, you are not exposed to those hormones. So any female who has fed her children well for more number of children, she will be protected. They have a protective effect. We have seen this disease more common in nuns and all who don't get married, who don't have children, who haven't fed them. So these are more relevant factors. Environmental factors are more of the lifestyle. Yes, obesity, poor food quality, exercise, lack of exercise, all those factors do add on. And environmental factors, there is no specific known environmental factors, but as we all know by common knowledge that so many carcinogens are now circulating in the system, and they definitely adding on to the carcinogenesis. But pointing out specific is very difficult. So we have to keep our environment, more healthy in general. But then there are specific lifestyle factors which we have discussed, which I discussed in the talk also. So we should encourage females getting married in time, having children, proper breastfeeding, long at least years breastfeeding is recommended. So these will definitely help.
Okay, thank you, sir. So the next one is, sir, one of our participant is a PCOD patient, and for that she has to change her lifestyle and switch to a healthy one. But during that change, she has to do some activities, and she got a lymph in the upper body. So, is that lymph due to the breast cancer thing, or it can be anything?
You mean to say lump? Huh? So if
Yes, sir.
she has developed a lump in the breast, you need not relate it with the exercises and all. It is just that maybe this exercise brought the lump into her notice. You know, so you will have a lot of females coming with the history that somebody hit in my breast, my children hit in my breast, and then I developed this lump. It is not that thing has produced that injury has produced that lump. Mostly that brings to your notice. So maybe when she was exercising, she was jumping, she noticed some abnormality, and this is how it came into her notice. Nothing to do with her exercises and all. And if she has, then we need to follow what we discussed today. She has to uh, get back to a specialist, and then he will decide what it is. Very difficult to comment without examining the patient and without having add-on information investigations.
Okay, sir. Thank you. Lastly, any suggestions or exercises to have a good health of our breast and keep the chance away of breast cancer?
All exercises are good. You have to do more of aerobic exercises, eat proper healthy food, no overeating. Keep check of your diet. Lot of fruits, lot of vegetables added to your diet. No junk food. All of us know what is healthy food, what is appropriate good for us, what exercises are good for us, what is a good lifestyle. We all know. It is question of following. We need not just ask. A lot of patients will just come and ask, okay doctor, क्या खाने में अच्छा? हम सबको पता है भाई, समोसा अच्छा नहीं है, कोल्ड ड्रिंक अच्छी नहीं है, पिज्जा अच्छा नहीं है, हरी सब्जियां अच्छी हैं, बट वो पूछने से नहीं होता है. इट इज बाय फॉलोइंग. है ना. जस्ट कि आ गए डॉक्टर के पास तो फीस दी है तो चलो पूछ लेते हैं, वो वाली बात नहीं होनी चाहिए. कुछ उसको फॉलो करो. यू नो व्हाट इज द आंसर. सो नॉट रियली रेलेवेंट unless one follows.
Okay, so thank you so very much, sir. It was indeed wonderful to have such knowledge which could help every woman over here to be aware about. Okay,
Thank you.
so
Thank you.
I request Dr. Sapna ma'am to kindly give vote of thanks.
Good noon, everyone. On behalf of Women Welfare Cell of the University, I sincerely thank our speaker, Dr. Vivek Aggarwal, to kindly accept our invitation and sparing a time from his busy schedule. Thank you so much, sir. I take this
Thank you.
opportunity to thank our Honorable Vice Chancellor, sir, to motivate us to conduct such events. And at the last, I also express my gratitude to all the organizing team members and the participants for their cooperation. Thank you. Thank you so much.
Thank you so much. Thank you.
Okay, so lastly, I request everyone to kindly switch on their cameras for just 2 minutes. I would like to take the screenshot of your presence over here. I request everyone to kindly turn on the cameras for 2 minutes only. Okay, thank you so much, everyone. It was amazing to have you
Yes,
all
thank
over
you so
here.
much. It was really a wonderful talk. Thank you.